I am going to talk about releasing your obliques. So those side abdominal muscles, you have your external obliques and your internal obliques. But think of those as kind of like your diagonal abdominal muscles. So when you think of side planks working your obliques, those are those muscles. So a lot of times with pregnancy, we can grip those muscles or they become tightened, and they're trying to stabilize for some of the other weakened and lengthened abdominals. So a lot of times we over grip and kind of tend to tighten those muscles. So postpartum, it's very important that we want to release those muscles so that they're not holding excess tension so that they can work properly. So because postpartum, we want all of our abdominals to start to work. We need all of them. So usually we start with the deep core, the deepest transverse abdominals, but then we want everything on board. We don't want to just stop there. We need all the abdominals working together for proper function of our system. So your obliques are on your side here. So I want you to lay on your side with that ball right underneath your side. And what I like to do is kind of roll your stomach down towards the floor and then up towards the ceiling and just kind of roll through. So you've got that kind of that space between your pelvis and your rib cage, as well as up closer to the rib cage. Your obliques kind of run across there. In any place that feels tender, you can kind of stop and hold there and just breathe. So if right here, maybe I would inhale. So if you're having a hard time getting your rib cage to move out to the side when taking a deep breath in, this might be something that you should work on regularly, maybe daily if you can, or at least a few times a week to kind of help release those muscles, because the muscles sit over the ribs. So if the ribs are stiff and the muscles are tight and not allowing full movement of the ribs, then that's going to affect our breathing. And we need that rib cage to move out to the side, especially when healing our core postpartum with pelvic floor issues. Rib cage movement is very important to managing the pressure in our system. So you're just gonna roll around, find spots that are maybe tender or just feel like maybe even sore to the with the ball placed over it. So if you kind of move into somewhere and it feels a little sore, that's a good spot to hold and breathe. And just do this all along your side abs there and do both sides and compare. So you can compare side to side. You can just roll, or you can just, not roll, you can just lay over the ball. So we were rolling in and out before, but you can also just lay over the ball, let your body just kind of fall over the ball and just breathe here. Let that side body expand down into the ball. Okay, so again, roll kind of forward and back. You can roll just up and down, in and out, lay over the ball and breathe, and just really let those obliques release so that we can release tension in those muscles so they can work properly and engage with all of our other abdominal muscles so that everything can work together for proper function of our core